opportunities, and publishing the full details of their analysis to help donors decide where to give. GiveWell recommends a short list of top charities and offers donors the option to give through their giving funds. Rather than reviewing as many organizations as possible, they focus deeply on a few exceptional programs, evaluating not just financials, but how much good each dollar actually does in terms of lives saved and improved. This session explores a newer focus for GiveWell, gathering more local insights, on-the-ground information from the communities where they fund programs. This includes feedback from participants and independent verification from local experts. And this kind of insight helps GiveWell better understand how programs really function, identify bottlenecks, and improve their decision-making. Our speaker today is Alex Cohen, principal researcher at GiveWell. Alex leads a team that reviews the quality of GiveWell's research and tackles cross-cutting questions that shape their grant making. Before joining GiveWell, Alex was Director of Learning and Evaluation at a private foundation in Indianapolis and a postdoctoral associate at the Yale School of Management. He holds a BA in Economics and Mathematics from Indiana University and a PhD in Economics from Yale. This session will include a Q&A after the talk, so please send your questions through to SwapCard. If we don't get through all of your questions, there will be an office hours happening at 12:30 after the session in Hall 2. Please join us in welcoming Alex Cohen.
Thank you, Haley. Really great to be here. This is my first time in Nigeria. Really excited to be at this conference. Get to talk to a lot of folks in this room. This is very exciting. Before we get started, I want to do a poll. All right, so I want to hear from folks in this audience about aid cuts. So the United States and other funders have recently announced reductions in foreign assistance to Nigeria and to other places. And I'm curious to know from folks in this room, how's that showing up for you, for your work, things you've experienced, what you're hearing from family, friends, what you're reading in the news. So would love it for folks to scan that QR code. It should take you to a page where you can fill in a box and fill in your responses to this. Think about, is this disrupting any access to care? Does this change attitudes? What's the government of Nigeria thinking about this? I'd be curious to know what you all are hearing, what you all are seeing, because this is a big question that we're thinking about for our work. I'll give folks a couple minutes to do that and put in some responses. Are we seeing any responses come through? We start putting them up. Great. Okay, so I'm going to read some of these. Don't let that influence your answers if you're still writing things in. I'm seeing more babies born with HIV. Notice the civil society space is shrinking because of lack of funding. Important work suddenly stopped. One person hasn't noticed any change. Professionals in the health space facing job security, mixed reactions. Some feel it's the best disruption Nigerians need to stop focusing on foreign aid, and others are devastated because projects that have been funded will end. Well, this is great. I really appreciate folks providing input. This is a question that we've been thinking about a lot at GiveWell, so great to get a little bit of feedback. All right, let's go back to the slides. All right, so today I'm going to be talking about how GiveWell is thinking about local insights in our work. This is input from people living, working in countries where we fund programs. I'm going to start off by talking about first, what does GiveWell do? Give a brief introduction to us. Then I'll talk more about what it would look like for us to get more local insights on our work. And then I'll conclude by talking about what folks in this room can do to contribute to that effort. I think this is a really great space to be talking about this. So I would love to end with a few calls to action for folks in the room today. So first, GiveWell is a funder of programs in global health and development. We receive funding from individual donors of varying levels of wealth. They entrust that funding to us, and then we grant that out. Last year, we did about 350 million in grants. We expect to do a similar number this year. Our goal when deciding which grants to make, which programs to fund, is cost effectiveness, maximizing cost effectiveness, looking for programs that try to reduce deaths, improve health, or raise income the most per dollar spent. So where does our funding go? Bulk of it goes to our top charities. So 70% to these four groups. They are Malaria Consortium, which provides seasonal malaria chemoprevention to prevent malaria, to the Against Malaria Foundation, which provides funding for insecticide-treated bed nets, Helen Keller International, which provides vitamin A supplementation, and New Incentives, which provides cash to caregivers that bring their kids in for routine vaccinations in northern Nigeria. That's where the bulk of our funding goes, but we spend a lot of funding also beyond our top charities. This is just a list of a few of them. I'm not going to go through all of them, but I've highlighted ones that we fund in Nigeria specifically. And some of the organizations that have done this work are in the room today, or at least at this conference. So beyond our top charities, we funded research on family planning programs. We funded malnutrition treatment programs. We funded software to assist frontline health workers. And recently we made a grant to a few countries, including Nigeria, to provide technical support on how to navigate foreign aid cuts. We do a lot of grant making in Nigeria specifically. I haven't done a thorough analysis here, but I think it's fair to say that Nigeria is the country that's received the most GiveWell funding. All of our top charities work in Nigeria, and several of our non-top charity grants are in Nigeria. This work is concentrated primarily in the north, but we funded throughout the country as well. So that's where we make grants. What are we looking for when we're investigating grant opportunities? Well, we ask a bunch of questions. We try to be very rigorous in finding programs that meet our high standard for funding. So first, we want to look at the existing evidence for the impact of these different programs. For example, what do the randomized controlled trials say about the impact of bed nets on mortality? Do they actually reduce rates of malaria? What about insecticide resistance since the original trials were funded? We look a lot at the evidence. Then we model cost effectiveness. Given these impacts, given the cost of the program, given our estimates on the amount of people that will actually use their bed nets for 1 year or 2 years, what's the cost effectiveness in terms of deaths averted per dollar spent? Then we look at a lot of other questions related to the organization, related to the program implementation, related to the location. But we're thinking about what sort of monitoring and evaluation does this organization do to make sure that the program is received by recipients? Do they review that data? Do they back check it? What track record does this organization have for funding this program? Are they viewed as a leader in this space? What do local policymakers think of the program? Are they bought into it? Do they think this is a worthwhile thing to be funding? And then we look at whether this program would be funded without us. So we look for places where our funding is truly additive. So if we fund a BedNet program that we think would have been funded by the government of Nigeria or by another funder without us, we don't think that's impactful because we're just crowding out funding from someone else. So we want to understand if this would be funded without us. Those are the questions that we look at. We answer them through a combination of what I'm calling desk research and beyond desk research. So desk research is we're sitting at our homes, we're reviewing the evidence for RCTs, we're looking at costing analyses, we're looking at monitoring and evaluation reports, we're building cost effectiveness models. Beyond the desk research is basically talking to a bunch of people, talking to implementers, local experts, government officials, policymakers, and beneficiaries, visiting programs in person sometimes, and then also commissioning research by others to go and learn more about program coverage. Are people receiving the vitamin A supplements that we thought? Doing qualitative interviews on this work. Typically, GiveWell has a focus much more on this first category, desk research. We do a lot of the things in this beyond the desk research category, but it's been the place where I think that we've done less than we should. And that's especially true when it comes to local insights. By local insights, I mean getting on-the-ground information where we fund programs. This means feedback from program participants. It means site visits, perspectives from local experts, doing independent checks on surveys. So we get data from our grantees showing that 70% of kids that were supposed to receive vitamin A supplements got them. Is that true when we do an independent check that wasn't done by the charity? This is important to us because we think by missing out on this local information, we may be making suboptimal grant decisions. We may be making grants that we shouldn't be making because they're less effective than we think, or we aren't making grants because we think they're not as effective. So a couple examples here. First is related to chlorination. So we fund lots of programs to provide chlorination for water, to reduce deaths due to diarrhea and other diseases caused by contaminated water. We recently did a few site visits to understand what these programs look like in person. And in particular, we saw how these organizations measure chlorination to make sure that people are actually using chlorinated water. And we noticed that there's a lot of subjectivity to how this is measured. So you typically dip a strip of paper into water, look at the color it turns, and that gives you a sense of whether it was chlorinated or not. But actually interpreting the color that the piece of paper turns is pretty subjective. There's a wheel that you use that tells you, okay, if it's this color, there's chlorine. If it's this color, there's no chlorine, but it's tough to interpret that. At the same time, we were getting some information from cross checks of our chlorination coverage data. So we got information from the charity showing, yes, we did this program and lots of people are using chlorine in their water. Then we got a second survey that was done independently and found much lower rates of chlorination. And that gave us some pause. It made us think, are we missing something by just taking the charity's numbers at face value here by not really understanding how these things are being used? So that's one example. Another is with an HPV program. So we were looking into a program to increase coverage of the HPV vaccine. We thought this was really effective at reducing cervical cancer deaths, but we learned kind of through talking to more people locally in the country, we were considering that coverage rates were already pretty high. Vaccination coverage of HPV was already fairly high, and so we thought there was limited impact of the support we would provide to increase those coverage rates. These are two examples where a program looked less promising than we thought based on getting these local insights, but there are others too where we might be able to gather information that makes a program look more promising or show us a program that we weren't considering before, weren't considering funding, that maybe we should. So what sort of information would we want to collect if we were gathering more local insights? I think we can split these into a few buckets. First is on, I think I did too many. No, we're good. First is on the program implementation side. We could learn more about the on-the-ground logistics. So if we're talking to frontline staff, that are delivering vaccination programs or malaria programs, what are the challenges that they face? Is it stockouts? Is it limited time? And how's that changing with foreign aid cuts? We could learn more about partnership dynamics. Our local stakeholders or local governments really bought into the programs that we're funding. How is what the organization that we're funding to do net campaigns or vitamin A supplementation campaigns adding on to what the government is doing already, and are they filling key gaps? And finally, we could learn about workload and incentives. Are we funding programs, for example, that are drawing away workers that would have been working for the government or working for other programs otherwise? And is that maybe an unintended consequence of our grant making? We could learn more about recipient behavior too. So talking more directly to people that are receiving these vaccination programs or malaria programs or other programs to understand, are actual baseline usage rates low? And if so, why? And are they low for reasons that could be addressed by providing free commodities or providing cash incentives for them? Or are these barriers not going to be addressed by this? We'd also like to learn more about perceptions and feedback. So if we talk to people that are receiving these programs, what do they think about them? Do they find them valuable? Is there anything about the program implementation that they would change or that is not as beneficial to them? Are there programs that they wish existed that don't? And finally, I think we could learn more about the broader ecosystem. So I said that we look for places where our funding is truly additive, where if we didn't fund this program, it wouldn't be funded by someone else. And we could do more to talk to people locally about this, talking to folks in the Nigerian government about whether they would fund BedNet campaigns if we didn't, trying to understand if we're crowding out funders and how that's changing, again, with limited funding due to cuts to foreign aid. We could also learn more about programs that we're missing. We funded these top charities and a few other programs. There are likely other very cost-effective things that we might not know about, and talking to people locally could reveal those to us. So those are the type of things that I think we could learn by gathering more local insights. Here's what we're planning to do about it. First, we want to expand our networks. We need to be talking to more people in countries that we're funding, developing relationships so that we get this information, learn about things that we're missing. We're going to be funding some more data collection, so funding surveys in Nigeria that provide additional checks on fluorination rates or BedNet coverage or why vaccination rates are low in some places, and triangulate that against the data that we're getting from charities. We're also thinking about funding cell phone panels so we can get data in real time, either as we're considering funding a program or once the program is running, and get information directly from program beneficiaries via cell phones. We'd like to do more site visits. We've typically done these for our programs, but we think we can do more of these. We also want to pilot doing work with local consultants. So this is finding people, say, in Nigeria, where we fund programs, who can go and collect information from us about the way programs are functioning, government priorities, what beneficiaries think. We think we could find people that are mid-career, well-connected, can interpret information from a variety of sources, from government officials down to the beneficiaries, and share that back with us in a way that could inform our grant making. But that's something that we're interested in exploring further. And lastly, funding some more qualitative research, doing more commissioning, more intensive interviews, again, with people on that chain from government decision makers to the program implementers, to the frontline workers, to the beneficiaries themselves. That's what we're planning to do. What can you all do? So I think there are three buckets where folks in this audience could add value for us at GiveWell. First is providing feedback on our work. The whole point of this local insights work is that we think there's information that we're missing, and we found in the past that external feedback can sometimes change our decisions. I would encourage folks in this room, take a look at our website. We publish the rationale for grants that we make, and tell us if there are things that you think we're missing, that we're naive about, that we're not thinking about. Look at some recent grants that we've made in Nigeria and tell us what we're missing. I'd be very interested in that. Second is recommending local consultants. If you have folks that you know that could be good local consulting candidates for us, I'd be interested in hearing that. And then finally, if you have feedback on this meta question of how can we get better local insights, so I've talked about a few things that we're trying, from developing our networks to collecting better data. What else can we be doing as funders that are based in the US and UK to better learn about how programs are functioning on the ground, what things that we're missing, programs that are promising that we might not know about? Very interested in that feedback as well. Like I said, this is a question that is very important to us. We think that we may be missing out on great grant opportunities, or we may be overestimating the impact of some programs that we fund by missing out on some of these local insights. So would be very grateful if folks in this room could help contribute to fixing that. Thank you very much.
Thank you so much for that, Alex. Can we get another round of applause? Okay, we'll be going into Q&As quickly. Reminder to send your questions in on swap card. So, Alex, how do you quantify the research outcomes you get from talking to locals? Is it like when making a decision, is it like completely randomized? Is there a scale of preference, or does it depend on the program?
Yeah, I think it's a great question. And I think at a high level, we're still trying to figure out the right way to incorporate this sort of qualitative information. Like I said, we've spent a lot of time on the desk research side, so reviewing the evidence from a randomized controlled trial, and we're pretty good at figuring out the right way to assimilate that information and build that into our cost effectiveness model. But yeah, when we hear things from the field, how do we incorporate that? I think is challenging. It's tough to know. One person said this program wasn't effective, or we got these data that disagreed with the data that we have. What should we believe? Or we talked to three different people and got three different answers. I think those are the challenges that we're going to have to face. And I don't have a clean answer in terms of, we're going to put 30% weight on this and 40% weight on this and incorporate that into our model. But I think part of this process is going to be figuring out the right way to incorporate this information.
So GiveWell's interventions appear to be very health focused. Are you currently exploring other development themes? And if not, will you be doing so in the near future?
Yes, that's right, that our programs steer more in the health space. At a high level, that's because we think there are programs that are fairly inexpensive, fairly impactful in terms of reducing child deaths and other really important outcomes. That said, we have funded in the past some non-health programs. We funded some programs to improve productivity of farmers. We've funded some research on a footbridge building program to connect markets. And going forward, we are continuing to look for programs in more of this livelihood space. So programs to increase consumption, to increase income. We've recently made a job posting for a program officer to lead that work. So we're hoping that we'll find some more programs in that space that we're missing.
What challenges are you currently facing with the on the ground?
Yeah, there are a lot of them. I think I guess I kind of alluded to some of them at the start. One is what do we do with qualitative information? A lot of times we'll hear differing perspectives from different people. We talk to two different experts on malaria funding and hear two different things. What's the right way to balance those sorts of things? I think another maybe the biggest challenge is figuring out who a good source of information is. So if we're reviewing a randomized controlled trial, we know, well, these are the characteristics that you look for. You look for, lack of attrition and baseline balance, and you look at a Cochrane review, and these are the things that make us trust this information. But if we're talking about talking to people, talking about individual program beneficiaries, or talking to local experts. Who should we trust and who should we put less stock in? I think that's something that we're still trying to figure out.
Yeah, thank you. Unfortunately, that is all we have for questions. Alex will be holding office hours now at 12:30 in Hall 2. So please come with your questions. Can we get it again for our speaker, Alex Cohen?
Thank you very much for your time, everybody. I really appreciate it.